start that. All right. Thank you all for joining us for the February 2023 Genetic Ambassador Call. As most of you know, we do these quarterly. And so this is February 15th, 2023 call. And I have an agenda here for us. I first want to acknowledge our funding from HRSA. Without their support, we could not do what we do. You all know who Mountain States is, so I'm going to skip to the agenda and just say we're going to do some introductions. That's my favorite part of these genetic ambassador calls, is learning and meeting people from other places. Genetic pop-up we have coming up next week, and so we're going to talk a little bit about that. And then I really want to reserve the most time for a conversation about this insurance resource for families for genetic testing that we're going to dive into. So with that, my introduction is I'm Christy Weiss, the projects manager for Mountain States. And I always love to have a question that we can share as we share who we are and where we're from. So the question I picked for this, since we're diving into a topic about insurance, is what is your best tip for working with medical health insurance companies? And so I'll start off with my tip is to write every name of every person that I talked to down with a date and what they told me in a notebook, because that has been so helpful in the past. And one other tip is trying to find out who in your medical or health insurance company might be the special healthcare special needs coordinator that you might be able to talk to the same person each time. That was hugely helpful for our family. So with that, I'll just roll call on who I see on my screen. So Kathy, you're up first. You want to introduce yourself?
Yeah, Kathy Salazar. I am now going to be like the family engagement advisor for the Department of Health, specifically the Children's Medical Services. I left Parents Reaching Out about a month ago. My best tip for working with medical health insurance companies is, if you have two, know which one is primary, which one is secondary. If you need a denial from your primary so your secondary kicks in, specifically Medicaid, then as a parent, those are really good things to know. How that all kind of revolves around itself, because it can be very frustrating when you're trying to get a piece of equipment that one doesn't cover, but the other one might.
Great advice. Great advice. Thank you. How about you, Elvira? I know you said you have to jump off, so you're next on my screen. Would you like to introduce yourself and then share if you have any medical health insurance company tips? If you're talking, we can't hear you. You're on mute. Okay, we'll come back to you, Elvira, if you're able to. I see you're still on mute, so you might not be in a place where you can talk. How about you, Winton? Do you want to introduce yourself?
Hey, yeah. Winton Wood, first and foremost, mom to a daughter, two kids, and my elder daughter has Down syndrome and autism. I also work at UNM Center for Development and Disability. I'm a program manager for the MEVIA and Supports Waiver, which are Medicaid Developmental Disabilities waivers. So pretty much what y'all said. I would just add to that, when you're kind of not familiar at all, I found, even just for myself and my own insurance, sometimes when I questioned things, maybe something on a copay statement or other, the people that you call don't always know everything. So sometimes if it doesn't quite seem right, question it and maybe call back, because I have gotten different answers from different people in the same place. So don't give up. And then one of my daughter's specialists taught me there are tricks from behind the scenes that the consumer doesn't know about. For example, he taught us for palate expander for my daughter that they will get 3 denials and on the 4th it will be good. And he said that before he even put in for the first prior auth for it to be covered. Yeah, but he knew that he knew how it goes.
He knew that he knew that he knew.
Yep. So, and I think we all have a tendency that those people that we don't know over there are such specialists that what they say is God's word. So if they say no, that means no, but that's not necessarily true, and to stick with it.
Great advice. Thank you, Winton. Elvira, are you in a place where you would like to introduce yourself, or Ken, unmute? If not, I'll go on to Jamie. Okay, not hearing Elvira. Jamie, do you want to introduce yourself?
Sure, I'm Jamie Stefanski. I am the state teams coordinator for MSRGN, as well as the genetic navigator for Colorado. I also have 2 kiddos. Well, I guess not kiddos anymore, but 16 and 14-year-old with a rare genetic disorder.
They'll always be your kiddos forever.
So yes, things that I would recommend. I agree with Christy asking for a care coordinator so that because they tend to know more of the specifics and ins and outs and tricks, and have a little bit more insight into the life and things that are needed for a family with children with disabilities or special health care needs. And also so you can have that one person to communicate with, rather than getting somebody different each time that may not necessarily know the specialty things. And it's really been a long time since I've had any issues with insurance, but I'm trying to remember back, asking specifically what codes are covered, and what labs are covered by, or if it's a matter of who writes the order, what physician. So really trying to think of those specific questions of, how do I get this covered? They're not going to answer the how do I get this covered, but trying to think through yourself, those different things that may come into play, and asking those specific questions, whether it's a specific code or who's writing the order. Also knowing that a lot of times when a physician writes, or even a therapist writes for a piece of equipment or something, whether it's like a communication device or durable medical equipment or something, they're not in your life and they don't know the specific ins and outs and everything, especially if they don't have a child themselves with special health care needs. And sometimes just writing that letter yourself of why you deem that piece of equipment is essential or medically necessary goes a long way to have your words in there for them to understand the reasoning behind it, and not just, oh, this piece of equipment is being ordered and we're going to deny it, so that they understand there's really implications and far-reaching things that impact the family's life and the child's life, why that piece of equipment is needed.
Great suggestions. Thanks, Jamie, for sharing. And I see that Lourdes has popped on. Lourdes, would you like to introduce yourself? And we're doing a question here. What's your best tip for working with medical health insurance companies?
Yes, good afternoon, everyone. My name is Lourdes Torres, and I am the genetic navigator for Texas. And I'm also a mom of three daughters, and my youngest one has an ultra rare genetic condition. And looking at this question, one of my best tips, not only for denials on medical issues or health insurance, is to keep documented everything and don't be afraid to ask questions and to have everything in paper. So, and it's a long time, like Jamie mentioned, it's a long time since I don't have problems with insurance and with the coverage of medical items for my daughter.
That means you guys have gotten good at it if you don't have issues anymore.
We're lucky.
No, great tips. Thank you, Lourdes, for sharing. And I see Tristan just popped on. Tristan, would you like to introduce yourself? We're just telling everyone where we're from, who we are, and then we're answering a question. What is your best tip for working with medical health insurance companies?
Okay, let's see. I'm not looking too pretty today. I'm sick.
That's okay. You don't have to. Oh, I was gonna say you don't have to turn your camera on. No worries. It's up to you.
You
Good to
quickly
see
see
you.
my face. I'll say hello. I'm Tristan West. I am in Utah and I'm part of the state team. And advice that I'd give for insurance coverage, is that what you said?
Tips for working with insurance companies.
I have noticed that doctors, like when they need to appeal and stuff, they don't have the time to really put into it. So if it's something super important, I go back through all the notes and I make bullet points and I send it to them. There's been times where I've like drafted a letter, sent it to them, say, hey, add what you need to. And that's been helpful to make sure everything's included, because so often I find out that they didn't include everything they should have.
That's a great tip. Help them do their job for them, but it makes it easier for them to submit and add to what you have already there, right? Great. Thank you, Tristan. Glad you're here. And Elvira, I just wanted to give you one more opportunity to introduce yourself if you're at a place you would want to unmute. If not, we'll move on to the next slide. Okay. Not hearing Elvira. Elvira is joining us from New Mexico, I know, though, and Family Voices, Navajo Family Voices. So glad to have you here today, Elvira. All right, with that, I'm going to just go on to the next slide. Just because we haven't met since we had our Genetics Summit, just a reminder to everybody that the recordings are up for our Genetics Summit. So if you missed any of those talks and you really want to go back and check out those talks or re-watch a talk or re-listen to a talk, this QR code will take you to the recordings page of all 12 of those sessions from our Genetics Summit. This is a great thing to share as well with families that you might work with. So just wanted to make sure that you have that. We do have continuing education credits available. So if you want to share it with your doctors or providers, they can watch the recording and get CME CEU credits for watching the recording. So that's a really nice feature. And we also have the 2021 summit still available for those CME credits as well. So both of those are live, are recorded, but available for what we call enduring credit. So just wanted to give you that heads up. So we are getting ready to have our genetics pop-up. As many of you know, we celebrate our genetics pop-ups traditionally around Rare Disease Day, and that was kind of our one time a year that we would have our genetics pop-ups. Last year, we introduced and connected our genetic navigators with our genetic pop-ups, and it was a suggestion that came out of that experience and from our genetic navigators to really spread the pop-ups out throughout the year so that we were constantly having something that we could invite families to as they were talking to families. And so we've done that. If you guys remember in the fall, we did the variants of uncertain significance pop-up, and we did a red flags pop-up in October. And now we're going to still keep our rare disease pop-up because it's near and dear to our hearts, and people have kind of come to expect pop-ups around this time. So that pop-up is happening next Tuesday, February 21st. I was just able to confirm Spanish interpreters. So I don't have a graphic yet for it that's in Spanish, but I have been able to confirm Spanish interpreters will be available for this pop-up. So that's just a new addition just in the last week. And this pop-up will feature a family story, and we'll also have some new slides that we put together based on a report that came out about rare disease in the last year that has it was really a deep dive report into the number of rare diseases out there and some of the barriers that families with rare disease have. And so we're going to be using some of that report, some of the data from that report to share as the information on that pop-up. So I hope you guys can join us. I have a little challenge. If you can do 3 things, to share it 3 places, that would really help. I just checked, I just sent out from the Mountain States Constant Contact account a flyer for this. So you can easily forward that and make it easy for you, but we're up to 80 registrants. So that's a great number for this pop-up. But if you would like to share it, we would really appreciate you sharing it 3 places, whether that be on a listserv or on social media, or send it out to your friends and family, or maybe you've just met a mom or a dad or a grandma or grandpa who might have gotten a recent diagnosis for their family and you'd like to invite them as well. So that is next February 21st. It is not Rare Disease Day. It's 1 week before Rare Disease Day. So Rare Disease Day is actually February 28th. But the calendar for Rare Disease Day is super full. NIH is having a Rare Disease Day event. FDA is having a Rare Disease Day event. So there's a lot going on the actual day. So we thought we'd jump in a little early and have it the week before. All right, with that, I'm going to switch gears to our main topic, and this is good timing because we have we have about 40 minutes that we can talk about this. So at our last genetic ambassador call, we were talking about a new project for this group because so many of you have been along the way working on the red flags for genetics and getting that off the ground, the survey and the actual handout, which is just going gangbusters. I just have to tell you guys and brag on you all a little bit is that we have other states contacting us about that red flag for genetics that want to customize it and use it in their genetic service public health work. So that's super exciting that other people have taken. It's gone to Puerto Rico. So the Spanish version, our NIMAC group took to Puerto Rico with them on a recent site visit and shared the Spanish version with families. So that's got some mileage on it. It's going lots of places, which is kudos to all of you on this call, because that was a project of this genetic ambassador group. And I just want to thank you all for the work that you did on that. So switching gears though a little bit, we have gotten a lot of requests from our genetic navigators. It's really the top question that they are hearing from families about: how do I get genetic testing paid for? So how do I get my insurance to pay for genetic testing? How do I afford genetic testing? All iterations of that, but really realizing that we don't really have a hard and fast resource that we can just hand a person or hand a family or work through with a family on. So it's been my goal to try to find something to see if something else existed before we created something. And I came across this guide. It is from a group called PLUGS, which stands for Patient Centered Laboratory Utilization Guidance Services, which is a mouthful, but they are a nonprofit that is out of Seattle Children's Hospital. And they really are a bunch of lab folks, a bunch of genetic counselors, a bunch of physicians that come together around laboratory utilization. So ordering laboratory tests is an easy way to say that, and stewardship of that. So making sure that they're not wasteful when they're ordering tests and they're not ordering too many tests. So it's a kind of a stewardship organization. So they had this guide that I came across about how to get complex lab tests covered, and it's for families. And so I reached out to them in the fall. We had a conversation about it at our management team retreat in December, and they were interested in partnering with us to have our family groups, you all as genetic ambassadors and our genetic navigator group, take a look at this guide and see if there's any way that we could work together on it to co-brand it and help them distribute it. Even further. It's already a guide in itself, and they already have it on their website, but they have said that one of their goals is to get it out to more people. So with all of that background, I thought we would dig into it today, because I would love if this group could help in that conversation, and then hopefully down the road, this would be a resource that we could then use within Mountain States and help get out further in Mountain States with some of the feedback that we give them. If there's ways to make it, improve it, or there's things that maybe it's missing that we could also suggest or maybe help them create alongside them. So with that, I'm going to stop sharing my screen. And I'm going to share the screen for the actual PLUGS guide so that we can just look at it together. And hope, oh, hi, Hannah, thanks for joining us. Let's see. So let's see. I'm sorry, don't have that tab open. Here we go. Okay. And I'm going to share the screen. I did send out the link to this. So if you want to have it on your own screen and have it, blown up to a better size, that might be better for you. I did send the link out in the email invitation today. And what I thought, well, so the genetic navigators went through this exercise with me on half the guide on Monday. So I got some great feedback from the genetic navigators. But I thought we would just work through some of it today with comments and thoughts. And so I want to start first, if anybody's gotten a chance to review the guide at all, did anybody have any just kind of first thoughts, like off the top? I love it, I hate it, I think it's great, but any response like that? Did anybody get a chance to peek at it?
So I did just a little bit. It's too wordy. It's too wordy for
Okay.
families.
That's-
It would be better if it was, you know, more bullet pointed, a much smaller version. I like what it says, the parts that I got through it, but it's just too wordy. It's just too much.
Yeah, great feedback. We heard something similar from some of our navigators, so great feedback. But there were parts of it that you thought were definitely worthwhile.
Yeah,
They
I
were
think
less wordy.
if they were less wordy and more bullet pointed, you know, for the points that it wants to make, I think it would be helpful. I think families have to remember this is very generic. So not everything will apply to their insurance. And of course, in my experience of as a parent, but then working with families, commercial insurance is very different than Medicaid, right? Very, very different. So they have to go at this with that this is an idea of how to tease out the information, but not expect this to be the actual information for that insurance company. Because
That's fair.
you know, yeah, I think it's a great resource, but always keeping in mind this is very generic and it's there to give ideas, not to give answers. Does that make sense?
Yes, and keeping in mind with that, as a federally funded grant, we have to be generic, right? Because we can't go out there and say this particular commercial insurance does it this way, right? We can't show bias to commercial or non-commercial entities. So there's a bit of that where we have to keep kind of at that 50,000 foot level. But I hear what you're saying, and I do agree that the commercial and Medicaid are quite different. But I thought this was a starting point where some of the things that they had in common could be teased out a bit. I would ask you, Kathy, have you come across anything specifically that you would recommend instead of this for genetic testing? So not general, how to get a CBC covered, but the thing that I liked about this is it says complex lab tests, but it's under an umbrella of genetic testing being one of those complex lab tests. So have you come across anything that's specific to genetic testing?
Not in this guide, but I can certainly go through it again with a little bit more pointed vision. I was just basically looking at it as a what the language said and how it said and how it relayed that. Genetic testing is becoming, number one, easier because you don't necessarily need a full thickness biopsy. Now it's usually can be done through blood work. And so, you know, I think the hardest part about genetic testing is, number one, who's ordering it, why are they ordering it, and who's going to get it afterwards. Those three things right there often cause a lot of confusion and upset for families. I know as we were going through it, you know, 6-7 years ago, the genetic testing had no answers. Last summer, we got answers, right? And they ran the same sample and it was within the time frame. And so remembering that for genetic testing specifically, that just because you don't get an answer now doesn't mean you're not going to get an answer in the future.
Yeah.
And so, so I can go through it again with a more specific guide for genetics. But I even doing the rare blood work that has rare lab tests that one of my daughters has to go through at least monthly, looking for like really off the chart stuff that you don't necessarily look for just because of her condition. Families need to know how and what's covered. You know, we're very fortunate that we have access to Medicaid for my daughter through a Medicaid waiver. So that has been able to pay for all of that. I don't know enough about the commercial end of the insurance as to what that looks like. So
Yeah, that's
in that
okay.
respect,
I
this was a
appreciate-
really great guide, is that it gave me questions to ask
Yeah.
or ways to think of it.
Great. I appreciate that first thoughts. Anyone else that got a chance to review it that has any first thoughts before we dive in? Because we can dive in right here together as well. So if not, anyone? Let's see. Oh, Winton, are you unmuted? Oh no, sorry. I thought you were unmuting.
I
Go
can
ahead,
say
Tristan.
something. My son has Home Alone in the background, so I hope you enjoy. One of the things I really liked was the thoroughness. I think, like what Catherine's saying, bullet points and organization would be great. I'm almost visualizing like this available in a digital form, so you can click on something and expand more, click on something and read more, because some people want less and some people want more.
Yeah.
And genetics is so complicated that I feel like if you want to truly understand and you're in one of those more complex situations, that the wordiness could be helpful, but just not at first glance, you know,
Yeah.
if there's a way to access some of that. And I just felt some of it was just not organized as cleanly. It wasn't as appealing to the eye, but the content very thorough. I wish I would have had something like that years ago. I haven't read through every word of it, but just going through it, I was pretty impressed that this resource existed, and it's exciting to think that we can somehow use that and maybe even improve it.
Great. Thank you, Tristan. I agree with you. I was at first impressed with the thoroughness because I could not find anything else out there. So again, I'm just asking Tristan, anyone on the call, if you know of something else out there that's like comparable to this, that we should be like looking at side by side with this, please let me know. But I also thought, and we talked about this a little bit with our genetic navigators on Monday, is that I felt like there were pieces and parts of it that could be pulled out and simplified, like this appeal checklist. It could possibly stand on its own with some simplifications as a one-pager. So I thought there was ways to like have the whole PDF and then maybe pull some things out that might stand alone or might be a tool that our genetic navigators use, or you all as genetic ambassadors, or maybe some folks that are working with family-to-family health information centers could use with a family, with your knowledge, being able to guide somebody through it, right? Rather than maybe guiding them through the whole 17-page PDF. Maybe you start with, okay, you have a denied test. Let's start there. Why was your test denied? Like, so chunking it up in pieces and parts. So we can talk through all of that, but I'm gonna say let's just look at the table of contents to start off with, and just to get the flow, the overview of it. And let's see if we could just work through maybe half of it today, and then maybe we can regroup in a month or so and talk through other ones, or other people can just take it and review that on your own and send feedback and comments to me. I am going to meet with Plugs in March. I let them know I was going to be talking to our families and getting some feedback. So I'm going to bring some feedback back to them in March, but it doesn't have to be all the feedback. So that was kind of the point today, was to gather some feedback from you all that I could take back to them and talk through maybe next steps. Again, this exists already as a completed project for them. So I don't know how much latitude there's going to be to completely rip this apart and put it back together. That's not the intention here. The intention is to get them some feedback to make it a little bit better if they're willing to tweak this or that, and then find out what they're willing to partner on as far as moving it forward to the next phase or the next stage, or how we can help disseminate it too. So just keep that in mind, that we're not here to completely dismantle the great work that they've already done. So this is the table of contents. They do a nice intro here about health insurance. They talk about coverage, coverage policies and how to access them. How do I find out if the lab test is covered? And before you get the test ordered, how do I appeal a denied request for a test? I just love this part. Why was my request for a lab test denied? I think it's the best list of answers that I've ever seen on why tests can be denied. and it's common reasons why lab tests are denied. And then it goes into this appeal section, right? Knowing your appeal rights, submitting when you submit an appeals checklist, and other issues. And then it talks about independent review organizations, getting medical records from the health plan, and then other sources of help. And then it has I think, a very amazing and very thorough glossary of terms. One thing I would love to see is that whenever the term is mentioned somewhere up here, that you click on it and it goes to the definition, or it pops up, kind of like what you were saying, Tristan, so you don't have to go look everything up in the glossary. I think that would be really, really fabulous. So let's just dive in. This is the first main page after the table of contents, and this is complex lab tests, how to get them covered, and about health insurance. So I'm just going to try to scroll up so that kind of mostly fits on the page. I'm going to go back to 100% if that's okay, because I think it's a little, if it's not too small of text. Is everybody able to see that still, hopefully? Any thoughts about this? I'm just going to bring up one thought that Jamie brought up on Monday, which is this sentence here, because we felt like that was a little misleading because of waiver programs.
And it's also a bit derogatory that only low-income people apply for, Medicaid because of that, because of the issues you're sorry. I know it's louder here. I'll
Oh, it's okay. No, I understand where you're coming from. I think it seems like it's missing the part about disability, developmental disabilities, some of the things that can qualify people in states that families may not know about is kind of what we were thinking. Jamie, do you want to expound on that? That was your comment from Monday.
Yeah, just that, so many people think that Medicaid's just for those with low income and financial needs based, and it's not. It's for those with disabilities as well, or special healthcare needs, and that statement doesn't help that situation. So I think there needs to be something to show people that it's for those with depending upon the state, because each state does have guidelines on what can qualify you for Medicaid or those waiver programs, but I think that statement is misleading in there.
Yep, go ahead, Winton. I see a hand raised.
Yeah, thanks. Yeah, so we encounter this all the time with things that have a lot of different eligibility criteria, and I think it would just be better to say, is a federally and state funded, healthcare program or something to that effect for those who are meet eligibility criteria blank, because it can be so many things. I mean, here, someone who's pregnant can get services, compared to someone the same income bracket who's not pregnant. Just if there's so many different things, and we're not the specialists on that. So, but I agree with Jamie about,
Yeah, great point, Winton. We were saying too that it's the purpose of this guide is you have to come in with the assumption that the individual does have insurance, either private or public, right? That the jumping off point for this guide is getting the coverage for the test with insurance. So we could make this the end all be all and ask them to add a whole bunch of how do you get signed up for Medicaid, but I don't think that's the scope of this particular document. And so I like your wording, Winton, is just, check your eligibility, ask the question and see if you're eligible in your state.
Well, in the last sentence, Medicaid patients may have a harder time getting access to all the healthcare services that a commercially insured patient that's not true. Actually, Medicaid patients, especially my children, get way better care than commercial rates that I would be eligible for. So I think that's a misstatement, and that is something that is not true at all.
Okay, great point. Thank you. All right, any other comments on this page 3 before I scroll down? And again, you don't have to read every word of it right here while it's on the screen, but we just kind of want to gather some comments if anyone had anything that was sticking out to them, like we've pointed out. Okay, I'm gonna scroll, and I see Hannah has put a comment. in the check or about the reading level, and that came up on our call as well on Monday. So I do think that's something to address. And I see that Lourdes said that it's wordy and that it's helpful to understand the process of submitting a claim through Medicaid, and that she likes the checklist. So just want to make sure and capture those on the recording here as well. So this next section is just continuing on that on the different plans, the health plans part. I thought some of this was a little bit, I don't know if families need to know all these code numbers and form numbers. That to me seemed a little bit excessive. Does anybody else have any thoughts about that? The CMS 1500 and UB 04?
Winton, these things change too. Forms change. I just wouldn't put those particulars because it can become outdated very quickly.
Yeah. I do think this based on CPT codes and having that link to what a CPT code is would be really great, because I feel like that's really crucial for people to understand when we're talking about insurance is CPT codes. So that was another thought I had.
Yeah, those two forms on there listed are pretty standard. That's more for a provider. The family doesn't need to know that, but as far as the CPT codes, that would be nice for the family to know what a CPT code is, because that's like the billing code, and then also maybe a diagnosis code, like so that they know. And that has changed as well, because that's an ICD-10 now and not an ICD-9.
Isn't it up to 11? Didn't I just hear they're proposing
11 now?
proposing 11? Maybe it's in the 11's in the works. Sorry.
I think it's in the works because we're still using ICD-10.
Okay.
Yeah.
All right. So maybe this forms stuff again. If you're trying to get it less wordy, that would be some place to take some words out, right? So maybe just this, right? In the bullet, going in the bullets point type of language. What does the form tell the health plan? This is the meat and bones of those forms, right? Okay, so the next section is how to access medical coverage, and it's kind of split here between 2 pages, but I think it's important to understand that there are unique policies for these 4 different areas. I think that's helpful, because I think I know for myself, like sometimes you don't realize that lab testing is different than like a procedure, right? Like, or like sometimes you think they're just all one, right? And that understanding that there's very different policies for each one of these type of areas. I feel like that's helpful. I don't know about you all. Maybe you all knew that intuitively. I didn't when I got into all this. Any thoughts on that?
You know, when the reality of the situation is that when somebody puts in for equipment, a test, a medicine, or whatever, and it is maybe denied by the insurance plan, a lot of times we as family members, even if we go to appeal it, what are we appealing for? We don't know. A lot of times it takes for the clinic, the hospital, the doctor to do peer-to-peers to kind of figure out why those have been right. Denied. So even though we look at the access for medical coverage on the policy, it might not be us who can necessarily push that through. So we have to work with our provider, but knowing the procedure codes versus the medicine codes, tests, why something is being asked for, run into families that go like, I don't even know what this is for. I don't know what this does. They may have been in an appointment where it all got thrown at them, and then they're like, oh, wait a minute, what is that for? And why am I appealing this? Or why did I get denied?
Good point, Kathy. I think I should have said that up front, is that to me, when I saw this guide, this is really helping the family be able to speak a language to work with their provider to do the things that you said. And so I should have said too, me finding plugs came from one of our speakers at our genetic summit. His name was Matt Fickey. He's a geneticist that works for a commercial insurance company. He spoke to providers from a provider perspective on how to get genetic testing paid for at our 2022 genetic summit. So I'd encourage you, if you didn't see that, talk to see that, because I feel like this is complementary to that, right? Where there's help we need to provide the providers, and there's help we need to provide the families, and we hope that they will meet together in the middle to have a conversation about how to get this covered, because it's not, one person can't just make it, snap their fingers and make it covered. So, and there's a section in this guide that talks about that I really liked about the medical letters of medical necessity and working with your provider. Go ahead, Jamie. I see your hand up.
Yeah, I actually like that section in there, because knowing when I'm the person in my family who decides on our healthcare coverage, I choose the plan, and it's not the same as it used to be. You used to get a booklet and now it's online, but they still give you a chart that tells you some basic things. And like for prescriptions, for example, there's first, second, third tiers, and they're each covered at a different rate, or there's certain types of meds that are not covered. So that stuff is important to know. So if a family, so you can say to them, well, you need to go check your coverage, because a physician's not necessarily going to know that stuff. They're not going to know your coverage. You can go check on your portal to see if that's covered or not. And then as far as like the codes, like whether it's denied or not, as a healthcare provider, I think it's even on the patient's EOBs, like underneath, like what's paid out and what's not paid and what's your responsibility. There's a code on there. And on the provider side, like when I was dealing with insurances up until recently, I'd get something that looks pretty much almost the exact same. There's a code underneath, like a number code that tells you the reason why it's not covered or why it was denied.
Helpful. That's helpful. Okay, so next section here is, how do I find out if a lab test is covered by my health plan? So this is the pre-work, right? This is asking before the physician orders the test. So doing your homework, contact your health plan, and then other tips. So any thoughts? Let me see how far. There's just 2 more lines down there before the next section. I don't know if I can get it all on the same page. Maybe if I go back a step, sort of. There we go. That's the whole section there on one screen. JB, did you have something else, or do you need me to lower your hand? Okay, sorry. So any thoughts on this? Good things, again, ICD-10 and CPT there, but again, I would love these to be linked, because if you're reading this and you don't know what that is, you're lost, right? And you might not even realize that there's a glossary yet. So to me, those being hyperlinked, I don't know if you've ever seen that, where they're hyperlinked and then it jumps you down to that, and then you can go back up to the document, even something like that, or one of those where you hover and the little thought bubble comes up. Those would be really cool. I'm sure way outside of, PDF formatting, you probably need it to be web page formatting, but that would be really helpful, I think. Any other thoughts on this section here?
I just think that sometimes when you're a parent and you're new at this whole game of really exotic lab tests or genetic testing or whatever's going on, sometimes you can't do your homework because you don't even know what the homework is. And so this is a great idea. But if you're just at the beginning of something, or for us, we were in the middle of something and had no idea, they're great ideas. It's just not necessarily homework that can be done until it happens, right? Because you don't know what to ask for if they're looking for a new diagnosis. Does that make sense?
That makes sense. Yeah. I think this is the section you're referring to here, right? Like, ask your health provider the name of the test they plan to order, as well as the name of the CPT codes. I think some of this too, you talk about the appointment where the kitchen sink just got thrown at you, right? So asking this in writing was something that we talked about on our Genetic Navigator call, is asking for something written down. And maybe there's even something that could go along with this, which is a form. So maybe you don't get the kitchen sink thrown at you visit. Maybe you go back to the second visit and you have a form that you could use with families that says CPT code, ICD-10 code that you could have, that the person could actually fill in. Because we were talking about, if you get one of these numbers wrong or transposed on one of these CPT codes or ICD-10 codes, you're off down another rabbit hole of a different diagnosis or a different test. So you're right. Some of this you can't do too much homework with. Some of it has to be after the visit, after you've gotten that information. But maybe this needs to say, do your homework after the appointment where the lab test is ordered, something like that. I thought I've used this in the past, and I don't know if it would be helpful here, or again, a separate sheet that's supplementary to this. On one of our genetic pop-ups a couple of years ago, I remember having a picture of a insurance card, right? And showing where do you find that number? I know that sounds really simple, but if you're brand new to this, you're like, what phone number do I need to call, right? And so sometimes just showing a generic card and saying, here's actually where you can find the number, and pointing to that with a little graphic. Sometimes that's helpful for people, again, especially if English isn't their first language, or if this is too wordy to read. A picture's sometimes worth 1,000 words. So, all right. I see a thumbs up from Winton. Okay, so we talked about this a little bit, this PAR, non-PAR. That wasn't super familiar language to me. It's in network, out of network is when you jump down to the glossary is how they're using it here. So I felt like that was a little bit maybe not common language. I know Jamie's a little bit more familiar with it from being a provider and using it on the Medicaid side, but is that familiar to any of you all on the call, PAR, non-PAR? I'm seeing head shake. Okay, so that might be something where the language could be simplified. Okay, let's skip down to this, how to appeal a denied request for test. I really love this little box here. Why was a request for a lab test denied? And I was even saying this is one of those things that I could see being pulled out, as a one pager, as a true checklist that could be used to walk through with a family if they come to you with a question, or come to one of our genetic navigators with a question and say, I got a denied whole exome sequencing, what do I do now? So just kind of walking through, obtain and read the letter about why the lab test was denied, obtain and read the explanation of benefits about the lab test, and then choose the reasons why the lab test was denied. See details about terms on 7, 8, 14, 17. That's a lot of places to look for all those terms, but I think it was Jen, our Montana genetic navigator, was even saying, maybe just even a short sentence that explains clerical reasons. Somebody made a mistake, or coordination of benefits, like a short sentence here, or short something in italics that just explains what these reasons are. This page down here, starting on page 7, gives very detailed answers to every single one of these checkboxes. So every one of those is explained further on this next page. But again, if this is standing alone, maybe just something short and sweet could be used as a guide to, maybe with assistance that a family's, working through this with somebody helping them. So any thoughts on that? I think it's the most comprehensive list I've ever seen as to why a lab test gets denied. I mean, I don't think some of these things I've ever thought of because I haven't experienced them. For sure, the clerical reasons, the wrong CPT code with the wrong diagnosis code gets kicked out of the system more times than not because of a wrong digit or something. That I've had that one happen to me way too many times. Lourdes says she likes the explanations on page 7 and 8. I do too, Lourdes. I think they are really, really thorough. I'll skip down to that so everybody can see them. But again, going back to Kathy's point at the beginning, a lot of words, and to Tristan's point too, but sometimes people might want the more words and the more explanation. So how do you kind of balance that? This would be another great place to have it where it has that little thought bubble or whatever, right? The clerical reasons. And if you hover over it or you click on it, it jumps down to here and gives you the whole paragraph about the clerical reasons. That might be a way to. And Tristan says, I think it would be helpful to mention that it's common for things to be denied the first time so they aren't surprised or think it's something wrong. Great point. I think that's the point that you brought up too, Winton, when you were giving your tips about, what was it, the expander, something, the palate expander or something you said gets denied 4 times or 3 times and then it's approved on the 4th. So great. That's a great tip, because I think you can easily get discouraged with a denial, right? And think that there's nothing more you can do. So maybe a little footnote. It's very common for things to get denied the first time, you know, don't give up, something like that. Okay, so here's the common reasons, like I said, pretty wordy, but again, could be simplified or could be retained, but then just simplified maybe on the checklist a little bit more. Okay, so I'm going to skip down to here to know your appeal rights, and this one is going into then the appeal section. So the next section is the appeal section. So maybe we can just see if we can get to this appeals checklist, and we're coming up on about 7 minutes left. So here's the appeals rights section. Any thoughts about that? Here's the peer review part that we were talking about, Kathy. And it does say to contact your provider to ask them to complete this on your behalf. I think just knowing you can appeal, I think that's probably what, you know, maybe just one sentence says you can appeal. That's your right. And then down here would be when you submit an appeal, be prepared before you submit appeal, review these tips, and then the checklist they're referring to is right down here in the green. I'm thinking that almost all explanation of benefits that I've seen has this appeal phone number included on them. Am I correct in saying that? Because it says make sure you have the correct appeal phone number. But for someone who's never done an appeal, I would be like, where do I get that? How do I know I have the correct appeal number? Am I saying that correct? That all explanation of benefits should have that listed?
It should be, well, at least the stuff that I get that's approved or denied always has a number that you call to do the appeal. I think the thing that's missing from here is, and it doesn't need to be specific, make sure that you abide by the timelines, because if you miss a timeline, then it has to start all over again.
Yep, 60, 90 day, whatever the time frame is listed. Yeah.
Yep. I think that's the only thing that's really missing from that.
That's great. So that should be another bullet point, I think. Yeah, Hannah, I just saw your hand go up. Go ahead.
Here, let me lower it before I forget. I was just wondering if there's any way that we could insert to mention that if your healthcare provider does have a care coordinator in the office, to kind of have that be sort of in the back burner for the family to, hey, I'm overwhelmed, but I need to follow up on this appeal or whatever, to just have that help be somewhere in this document. I mean, I don't know where it would belong, but I think that would really help the family.
That and I think you brought up on Monday too about just the tip that a care coordinator may also be available on the insurance side, right? To be able to speak to the same person each time as well. So I feel like maybe that's an additional section. I don't know. Care coordination or where you can go for help. I think there is a help section, so maybe it would fit more in the help section. Great point. Thank you for bringing that up. Okay, so this is the appeals checklist. Again, I think this could really nicely make a one-pager as well to pulled out again. What is it? What's everybody think about this? Does this one say anything about timelines? I was just gonna scan for that because that might need to be added as well. I'm not seeing a timeline one. Yeah, so that might be another additional checklist, is or a checkbox. Really close to the top, right? check how long. It does have a due date, but I feel like that almost needs stressed more. Would you agree, Kathy? Like that basically you're out of
Yeah,
luck
'cause-
if you're past that date.
Yes, I mean, it's kind of sort of there, but I would definitely make this maybe its own checkpoint
Yeah.
and not part of the top one.
Yeah. Due date with a box here, but with some note.
Yeah. Because it also depends on what appeal is it? Is it first appeal, second appeal, a fair hearing? What is it? What is that?
Right.
So, or whatever their state or medical system looks like. So,
Right.
Yeah.
Right. I think this is great. Again, medical necessities, that term is like a really new term. If you're brand spanking new and this is your first appeal, medical necessity is not going to mean a whole lot to you. So again, having those or investigational or experimental, I know we've all seen that probably a couple times on some denials. So just having those linked or something so people know what those mean. I think this is really, for me personally, I think this is fairly thorough though, just with maybe a couple tweaks. Is anyone seeing anything else that's missing that they think really should be added here?
I have a question.
Yeah, go ahead.
I don't know how often this happens, but in our situation, we've had a couple of times where the doctors at first have been like, okay, this is the process. And then if it comes back, we can appeal. And then I end up getting a paper from the office saying there's no need to appeal. And it's been frustrating to be like, oh, the doctor said that they would help me appeal, but now they're not. And so
Okay. You're
I don't
saying from the peer-to-peer perspective, like they're not going to your office, the office where your physician is at is not going to step in and do a peer-to-peer, something like that.
right.
Okay.
Right. Yeah. And I don't know then if it's just like just advice again, like to not give up, find another provider who might be able to advocate for you or something. And maybe that was just unique to us a couple of times, but I think it's just because they get too busy and they have to sometimes pick and choose what they do, or they may want to know how important it is to that person. And you may have to call the office and be like, you said you would help me appeal. So I just feel like sometimes it's easy to be brushed off even by the providers.
Yeah, great point. I think that's and your tip that you shared with us in the beginning about helping them, if it's not a peer-to-peer, if it's the writing letter stage, right? Letter of medical necessity, even drafting that for them is a great tip. To include somewhere, right? If the family has the ability to do that, that's a great tip. All right, so I'm going to stop here because we're pretty much at the top of the hour. I really appreciate your feedback on this, and I'm going to take this back to plugs if that's okay with you all, and then regroup with them. And then if you have any other comments, if you want to take a peek at some of the other pages here, it's 10 through 14, and then 15 starts the bottom of 14 starts the glossary. So really 14 through the very end to 17 are all the health plan terms, these green terms. So just FYI, it's really only to 14. So we only have like about 4 more pages, I guess, is where we got to. That if you want to take a quick peek, and if there's anything glaring there, if you would just want to type it in an email to me real quick and send it, I will include that in my conversation with them in March. But I'm really excited about this opportunity to do something with this because I feel like it could be really helpful across our region. It is general enough that could be used in every state, I think, as written. But then with some tweaks, maybe making it even better. So I appreciate all your time today, and I will stay on if anybody has any last thoughts or comments, but I want to be respectful of everybody's time since we're at the top of the hour. So thanks for joining me today. Bye, Winton. Bye, Jamie.
Christy, I have a quick question.
Yeah, go ahead. Let me stop sharing and then turn off the recording if that's okay.
Yeah.
Stop recording. Where's my stop recording? There we go.